Okay, let's unpack this. We often think of heart problems in people, but the reality is our animal companions can experience incredibly complex cardiac issues too,
That's right.
including some really strange and, well, unsettling heart rhythms. And today, we're diving deep into one that comes up frequently in veterinary medicine, ventricular premature complexes.
Yeah, VPCs, or sometimes people say PVCs, or ventricular ectopi. Basically, you can think of them as these unexpected sort of extra heartbeats.
It's extra beats that sneak in.
Exactly. They interrupt the normal, steady rhythm the heart usually follows.
So our mission for this deep dive, using a pile of detailed veterinary sources, is really to cut through the complexity. We want to pull out the essential insights for you.
Mhm.
We're going to help you understand exactly what these weird beats are, figure out the surprising reasons why they might happen, how vets actually spot them, and explore what can be done about them.
We're basically sifting through all that dense info to get to what really matters for you. Consider us your guides on this one.
So let's kick off with a basic question. What is a ventricular premature complex really, at its core?
Simply put, a VPC is an electrical impulse that starts abnormally. It starts down in the ventricles, those big muscular lower chambers.
Instead of the usual starting point.
Right. Normally, the heartbeat starts way up high in the heart's natural pacemaker, the sinus node, which is in the atria, the upper chambers.
Ah, okay. Because the normal system is like a really precisely timed electrical circuit, isn't it?
It really is. The signal starts high up, travels down this specific electrical highway, pauses just for a moment at the AV node, and then spreads super quickly and evenly through the ventricles. That gives you a nice, strong, coordinated pump.
But a VPC skips that highway.
Totally bypasses it. It just pops up spontaneously from some irritable spot directly within the ventricle muscle itself, or maybe its local wiring system down there.
And because it's not using the fast lane.
The signal spreads slower, more haphazardly,
Mm-hmm.
and the contraction that results. It's often weaker, less effective, and electrically it looks really different.
And that difference is what vets see on an ECG, right? The electrocardiogram. Our sources kept saying they look wide and bizarre.
Yes, that's the classic description on the ECG strip. The QRS complex, that's the big spike, showing the ventricle's electrical activity, it's much wider, and it just looks, well, abnormal compared to a regular beat.
And it happens early.
Yeah, it's premature, comes in before the next normal beat is expected. And crucially, it happens totally independently of the normal atrial signal, the P wave. You often won't see a related P wave right before it.
And there was that interesting detail about the pause after the beat. That helps tell them apart.
Absolutely. It's a key feature. A typical VPC is usually followed by what we call a compensatory pause,
Compensatory.
meaning the heart kind of resets itself after that unexpected early beat. It waits just a little bit longer than usual before the next normal beat comes through from the sinus node.
Ah, okay.
And that pause length is different from some other types of premature beats that might have a non-compensatory pause. So yeah, that little pause helps the vet figure out where the problem beat started.
Fascinating. It's just a tiny pause tells a story. And these aren't always just single random beats, are they? They can show up in patterns.
Oh, definitely. And the pattern gives us clues about how serious they might be. You can have just single isolated VPCs. That's pretty common.
Okay.
Or they can come in pairs, we call those couplets. 3 in a row are triplets.
And more than 3.
4 or more VPCs running together. That's actually classified as a run of ventricular tachycardia, or VT.
Ventricular tachycardia, that sounds much more serious.
It is, because it's a fast rhythm originating from the wrong place, and it can really impact blood flow if it keeps going.
Wow. Any other pattern?
Yeah, and you get these really regular patterns too. Like if every other beat is a VPC, that's called bigeminy.
Digeminy, okay.
If every third beat is a VPC, that's trigeminy. And sometimes the VPCs don't even look the same as each other on the ECG. They have different shapes.
What does that mean?
That suggests they're coming from multiple different irritable spots in the ventricles. We call that multiform or polymorphic VPCs.
Okay, so we've got a handle on what they are, what they look like electrically. But the really big question is why? Why do they happen? What makes the ventricle suddenly decide to fire off these extra beats?
Right. And this is where it gets really interesting and often quite surprising for pet owners. Because while sometimes, yeah, it's clearly a problem with the heart muscle itself, very, very often the root cause is actually somewhere else in the body entirely. The sources kind of break it down into 2 main buckets: primary cardiac disease, so problems originating in the heart,
Okay.
and systemic diseases, meaning non-cardiac problems elsewhere. The big insight here is just how incredibly sensitive the heart's electrical system is to trouble brewing anywhere else.
Okay, let's start with the heart problems first. That seems more intuitive.
Sure. Diseases of the heart muscle itself, the cardiomyopathies, they're a major cause. Things like dilated cardiomyopathy,
Ugh,
DCM.
where the heart gets big and floppy.
Exactly. It gets enlarged, stretched out. You see it a lot in large and giant breeds. Dobermans, Boxers, Great Danes are classic examples. That stretched, weakened, diseased muscle is just electrically unstable.
And you mentioned one specific to boxers, ARVC.
Yes, arrhythmogenic right ventricular cardiomyopathy. That's a nasty one, where the normal heart muscle, especially on the right side, gets replaced by fatty tissue and scar tissue.
Which doesn't conduct electricity properly, I assume.
Not at all. It's incredibly prone to generating these dangerous arrhythmias. And then in cats, you often see hypertrophic cardiomyopathy, HCM, where the muscle gets too thick. That can also trigger VPCs.
So basically, damaged or remodeled heart muscle gets electrically twitchy.
Twitchy, angry, irritable, exactly. Other direct heart issues could be inflammation, like myocarditis, severe valve disease, if it causes the chambers to get really stretched out, heart tumors, though less common, or even direct trauma to the chest.
And there was that inherited one.
Ah, yes, absolutely. Have to mention inherited ventricular arrhythmia. The sources highlight this, particularly in German Shepherd dogs. It often shows up when they're young. It seems to be a primary electrical problem. The wiring itself is just faulty from the get-go.
Okay, those make sense. Heart problems causing heart rhythm problems. But you said the systemic causes, the non-cardiac ones, are where it gets really interesting and sometimes surprising.
It truly is. This is where the heart is basically acting like an alarm system for the rest of the body. A classic and really serious example is how gut problems can cause severe VPCs.
Gut problems, really?
Yeah, gastric dilatation and volvulus GDV, or bloat in dogs, it's notorious for triggering really dramatic ventricular arrhythmias.
Wow.
It's a perfect storm, really. The dog is in shock, the twisted stomach releases all these inflammatory factors, electrolytes go completely out of whack. It all combines to make the heart's electrical system just go haywire. Pancreatitis inflammation, the pancreas is another big one.
So a life-threatening stomach twist can cause life-threatening heartbeats. That connection is incredible.
It really highlights how interconnected everything is. It's not just separate boxes. Problems with the spleen, too.
The spleen.
Yeah, splenic masses like the cancer hemangiosarcoma are often associated with VPCs. And interestingly, even the stress after spleen removal surgery can cause temporary VPCs, though they often settle down pretty quickly.
What other non-heart triggers are there?
Oh, electrolyte imbalances are huge. This is a critical point from the sources, really vital. Low potassium hypokalemia and low magnesium hypomagnesemia.
Why those two specifically?
Because potassium and magnesium are absolutely essential for the normal electrical function of heart muscle cells. They maintain the charge, the stability. Think of it like if the battery fluid chemistry is off, the battery doesn't work right. Same idea.
So just mineral levels being off can cause dangerous heart rhythms. That's, wow.
It is profound. And it's why blood tests are so incredibly important in these cases. High potassium or low calcium can also cause issues.
Okay, what else systemically?
Widespread inflammation or infection. Sepsis, that's called SIRAS. Severe pain from any cause.
Pain itself.
Yes, pain triggers stress hormones like adrenaline, and those can definitely make the heart more irritable. Not getting enough oxygen to the heart muscle, maybe due to severe anemia or breathing problems. Acid-base imbalances in the blood.
Hormones.
Definitely. Endocrine diseases, hyperthyroidism, especially in older cats, that revved up metabolism puts a strain on the heart. And hypoadrenocorticism, Addison's disease, which often leads to dangerously high potassium levels.
And toxins or even medications?
Yes, the sources point to certain anesthetic drugs. Some heart medications themselves, ironically, if the dose isn't right, certain chemotherapy drugs like doxorubicin, and specifically digoxin toxicity, that's a well-known cause of ventricular arrhythmias. Even things like tick-borne diseases have been implicated.
It really sounds like almost anything that puts major stress on the body could potentially disrupt the heart's electrical rhythm.
That's a really good way to think about it. The heart is just exquisitely sensitive to the body's overall state. And, sometimes, even after looking really hard, you just can't find an obvious cause, particularly if it's just occasional isolated beats. We call that idiopathic.
So given all that, if an animal has these VPCs, how would anyone even know? What signs might an owner notice, or what would a vet pick up on?
Well, the first key insight here is the massive range. A lot of animals are completely asymptomatic.
No signs at all.
None whatsoever. The VPCs might just be an incidental finding during a routine checkup, Maybe the vet hears an odd beat while listening, or they show up on tests done for something else entirely.
So the vet listening to the chest is often the first clue.
Often, yes. They might just hear an irregular rhythm. Sometimes owners might notice something subtle, like they feel a little flutter in their pet's chest when they're petting them, or it feels like a skipped beat. That could be the animal actually feeling the palpitation.
And during the exam, besides just hearing it, what else might the vet find?
A really crucial finding, if the VPCs are happening frequently enough, is something called pulse deficits.
Pulse deficits.
Yeah.
Yeah.
The vet listens to the heartbeat with their stethoscope,
Mm-hmm.
while at the same time feeling for the pulse, usually in the artery in the back leg. With a VPC, you hear that electrical beat through the stethoscope thump,
Mm-hmm.
but because that contraction was early and often pretty weak,
It doesn't push enough blood out.
exactly, it doesn't generate enough pressure to create a detectable pulse wave all the way down in the leg artery. So you hear a beat, but you don't feel a corresponding pulse. Beat, no pulse. That's a pulse deficit.
Okay, that paints a really clear picture. The heart tried, but it wasn't effective.
Right. And if you have lots of these ineffective beats happening, especially in rapid bursts like ventricular tachycardia, the overall amount of blood getting pumped out to the body can drop significantly.
And that's when you see more obvious signs.
That's when you start seeing things like weakness, lethargy, maybe the animal just doesn't want to play or exercise like they used to.
Mm.
They tire out really easily. It's all due to that reduced blood flow.
What about the really serious signs?
The most alarming sign, and a huge red flag that the arrhythmia is causing major problems and could be life-threatening, is syncope,
Fainting.
fainting, collapsing.
Yeah.
It usually happens when there's a run of really fast, sustained ventricular tachycardia that drastically cuts blood flow, especially to the brain. If you see an animal suddenly collapse, a serious arrhythmia like VT has to be high on the list of possibilities.
And could you see signs related to the underlying cause, like the heart failure?
Oh, absolutely. If the VPCs are happening because of underlying congestive heart failure from, say, DCM, then you might also see signs of that failure like coughing, difficulty breathing, maybe a swollen belly from fluid buildup.
And the worst case scenario?
Tragically, yes. Especially in those breeds that are genetically predisposed, like boxers, Dobermans, German Shepherds. Frequent or complex VPCs can sometimes deteriorate into a completely chaotic, non-functional rhythm called ventricular fibrillation. And that leads to sudden death.
Okay, so spotting them can range from nothing to, well, the absolute worst. How do veterinarians actually pin this down? Confirm the VPCs, figure out the why, and assess the risk.
Well, it definitely starts with that good physical exam, listening carefully, feeling for those pulse deficits we talked about.
Right.
If they hear something irregular, a resting ECG is usually the next step. That confirms, okay, yes, these are VPCs, shows what they look like. Are they wide, bizarre? Is there a P wave?
Yeah.
And gives you a snapshot of the rhythm right now.
But you mentioned they're often intermittent, so a short ECG might miss them.
Exactly. And that's a key insight from the sources. The resting ECG is often not enough. The real workhorse for diagnosing and assessing these intermittent arrhythmias is the 24-hour ambulatory ECG, the Holter monitor.
The Holter, why is that so crucial?
Because an animal might have thousands of VPCs over a day, but just happen to have none during the 5 minutes they're hooked up in the clinic. The Holter records every single heartbeat for a full 24 hours, while the pet is going about its normal life at home, sleeping, eating, playing, walks.
Gives you the whole story.
The whole story. It lets the vet quantify the arrhythmia. Are we talking 10 VPCs a day or 10,000? It catches those dangerous runs of VT that might only happen sporadically. And really importantly, it allows them to correlate the rhythm with any signs the owner might be seeing and noting down in a diary.
Like, he seemed weak right after his walk at 2 p.m., and the Holter shows a burst of VT then.
Precisely. Did he collapse when his heart rate hit 250 beats per minute? That kind of correlation is gold for figuring out how significant the arrhythmia is it malignant, and deciding if and how to treat it.
And the Holter is also the best way to see if treatment is actually working later on.
Absolutely. Once you start antiarrhythmic drugs, a repeat Holter is the gold standard. The goal, as mentioned in the sources, is often looking for more than an 85% reduction in the number of UPCs. A quick clinic ECG just can't reliably tell you that if the problem comes and goes.
Okay, so Holter is key for the electrical side. What about looking at the heart muscle itself, the structure?
That's where the echocardiogram comes in, the heart ultrasound. It's essential for looking at the physical heart. How big are the chambers? How thick are the walls? Are the valves working properly? How strong is the pumping function, the contractility?
So it helps find those underlying causes like DCM or HCM.
Exactly. It's crucial for spotting DCM, ARVC, HCM, severe valve disease, even heart tumors sometimes. But it's important to know, sometimes the echo can look surprisingly normal, especially in early ARVC, or that inherited ventricular arrhythmia in German Shepherds, even when the electrical problem is quite severe.
And given that long list of systemic, non-heart causes we talked about, blood work must be critical too.
Oh, absolutely critical. A full panel. You need a CBC to look for things like anemia or signs of infection. The biochemistry panel checks organ function generally, but especially for arrhythmias, you're looking really closely at those electrolytes. Potassium and magnesium levels are vital.
Right, the battery fluid.
Exactly. And thyroid testing, especially T4 levels in cats, is pretty standard.
What about those cardiac biomarkers you hear about?
Things like troponin I or NT-proBNP, yeah, they can be helpful. Elevated levels suggest there's been some injury to the heart muscle or that it's under stretch, which can support the idea that underlying heart disease is playing a role. And of course, specific infectious disease tests if things like myocarditis are on the radar.
Any other imaging outside the heart?
Yeah, chest x-rays are often done. They help assess the overall size and shape of the heart, and importantly, look for signs of congestive heart failure, like fluid in the lungs. And if you suspect a non-cardiac trigger, an abdominal ultrasound might be needed to look for things like splenic masses or signs of pancreatitis.
And the sources mention vets have to be careful not to mistake other things for VPCs.
Right, the differential diagnosis. Sometimes a beat that actually starts above the ventricles, a supraventricular beat, can travel down through the ventricles using an abnormal pathway. This makes it look wide and bizarre on the ECG, mimicking a VPC.
So how do they tell the difference?
It takes careful analysis. The vet looks very closely for any sign of a P wave associated with that wide beat, even if it's hidden. And they look carefully at that pause afterwards. Remember the compensatory pause for VPCs?
Yeah.
If the pause is compensatory, it strongly points towards a VPC. If it's non-compensatory, it might suggest it's actually supraventricular with what they call aberrant conduction. It's a bit of an electrical puzzle sometimes.
Okay, we've gone from spotting them, diagnosing the cause, figuring out how serious they are. What happens next? How do vets actually approach treating these complex beats?
Okay, here's the absolute #1 rule, the most critical insight from all the sources. If you find an underlying cause, you must treat that first and foremost.
That's the golden rule.
It really is. Those VPCs caused by systemic problems. The DDV, the pancreatitis, the low potassium, they will often dramatically improve or even go away completely once you have the primary problem under control. Fix the bloat, manage the pancreatitis, get potassium supplements, and the heart rhythm often just settles right down.
So often the arrhythmia is just a symptom, and fixing the root cause is the real cure for the heart rhythm issue.
In many systemic cases, yes. The specific antiarrhythmic heart drugs are mainly reserved for situations where treating the underlying cause isn't enough or isn't possible, or, very importantly, when the VPCs themselves are causing significant clinical signs or posing a direct threat.
So not every dog or cat with VPCs automatically needs heart rhythm medication.
Definitely not. If an animal has just occasional isolated VPCs, looks and feels fine, has no signs, the vet might just recommend monitoring. Medication is usually indicated if the animal is showing signs because of the arrhythmia, the weakness, the fainting, the exercise intolerance we talked about. It's also generally recommended if the VPCs are very frequent or if they're appearing in those complex forms like couplets or runs of VT. And especially if they see that really dangerous R-on-T phenomenon.
Ah, yes, the VPC landing right on that vulnerable spot.
Right, because that has a high risk of triggering ventricular fibrillation. So R-on-T is a strong indicator for treatment. Medication is also used if the overall picture of the breed, the underlying heart condition, the sheer number or complexity of VPCs suggests the arrhythmia is malignant or carries a high risk of sudden death.
So if drugs are needed, what are the common options?
Well, in an emergency, like an animal comes in collapsed with rapid VT, the go-to drug given intravenously is often lidocaine. It works quickly.
Okay, for emergencies, what about for long-term management at home?
For chronic oral medication, common first choices are often beta blockers. Drugs like propranolol, atenolol, metoprolol, or a drug called sotalol, which actually has both beta blocker and another type of antiarrhythmic effect, class 3.
How do they work?
Generally, they slow the heart rate down and help stabilize the electrical activity, make the ventricle less irritable. Sotalol is frequently mentioned as a good choice especially in breeds like Boxers and Dobermans that are prone to these issues.
But you mentioned earlier, be careful with beta blockers if the heart's already weak.
Yes, that's a really important caution. Beta blockers can sometimes reduce the heart's pumping strength, especially initially. So if an animal already has significant congestive heart failure or very low blood pressure, you have to use them very cautiously, maybe start with a tiny dose or sometimes avoid them altogether.
So what else might they use in those cases? Or if the first drugs don't work well enough?
If heart failure or low blood pressure is a big concern, other drugs like Class I antiarrhythmics, mexilotide is a common one. Sometimes procainamide might be chosen instead, or often used in combination with a beta blocker or sotalol, especially for really persistent arrhythmias. That combo is used a lot in boxers with ARVC.
Any other options for really tough refractory cases?
Amiodarone is another potent antiarrhythmic, but it tends to have more potential side effects, so it's often reserved for cases where other drugs haven't worked. And the sources mention maybe avoiding it in Doberman specifically. For cats, if atenolol isn't tolerated well, sotalol or procainamide might be alternatives. And it's really worth reemphasizing some drug cautions the sources brought up. Vets usually try to avoid drugs that stimulate the heart, like atropine or adrenaline-type drugs, until the arrhythmia is under better control because they can make VPCs worse.
Okay.
Bigoxin, which is used for some other heart conditions, has to be used very carefully because it can actually provoke or worsen ventricular arrhythmia sometimes. And that interesting point about German Shepherd's drugs like sotalol, which prolong the electrical recovery time of the heart cells, might actually make their specific type of inherited arrhythmia worse. It's a crucial detail for vets treating that breed.
Wow, lots to consider with the drugs. Beyond medication, what else is involved in managing these animals?
Supportive care is often key. That might mean oxygen therapy if they're struggling to breathe, intravenous fluids to help maintain blood pressure and organ perfusion, and really importantly, effective pain control if pain is suspected to be a contributing factor.
And activity.
Activity restriction is usually recommended, especially if the animal is showing clinical signs or has significant underlying structural heart disease. You don't want to push a heart that's already struggling or electrically unstable. And client education is huge. Owners need to understand the condition, what the treatment is trying to achieve, what signs to watch for, and unfortunately, the potential risks like fainting or even sudden death in some cases.
What if an animal with known VPCs needs surgery for something else?
That requires careful planning. Continuous ECG monitoring during anesthesia is absolutely essential. The sources mention that using pre-medication drugs that help calm the nervous system, like asapromazine, might actually help raise the threshold for triggering ventricular fibrillation, which is good. They generally try to avoid things that could excite the sympathetic nervous system during induction, like mask inductions, or using anticholinergic drugs unless the heart rate gets too slow, as that stimulation can make the arrhythmia worse.
Okay, so we've tracked this from detection through diagnosis and treatment options. What's the bottom line? The long-term outlook, the prognosis for these animals.
Well, the key insight here is that the prognosis is incredibly variable. It almost entirely depends on the underlying cause.
So if it's something straightforward and fixable,
If the VPCs are clearly secondary to something like a temporary electrolyte disturbance that you correct, or maybe pancreatitis that resolves, or even the stress after a GDV surgery that gets better, if that underlying systemic issue is successfully treated and goes away, then the prognosis related to the VPCs is generally good. The arrhythmia might resolve completely or become so infrequent it's not a clinical problem. Okay, but and this is the big but. If the VPCs are associated with significant progressive underlying heart disease, like advanced DCM or severe ARVC where the muscle is being replaced, then the prognosis is much more guarded.
because the heart disease itself is serious.
Exactly. The underlying cardiomyopathy often carries its own significant risks and limitations, and adding frequent or complex VPCs on top of that substantially increases the risk of sudden death from ventricular fibrillation.
So in those cases with serious heart disease, monitoring becomes absolutely critical for the long term.
Absolutely essential. Regular checkups, and especially repeat Holter monitoring, are vital. You need to know, is the medication actually working? Are we achieving that target reduction in VPCs, like the 85% goal? Are complex patterns like VT being suppressed? Serial ECGs in the clinic just aren't reliable enough for that. And you have to constantly be vigilant about correcting any contributing factors, keeping electrolytes normal, ensuring good oxygenation, managing pain.
And reminding ourselves of the main serious risks we're trying to manage.
The big ones remain syncope, fainting, or collapse, and sudden cardiac death. Those are the potential complications that really drive the need for thorough diagnosis, careful risk assessment, and appropriate management, especially in animals with symptomatic arrhythmias or high-risk underlying conditions.
Right. Well, that has certainly been quite the deep dive into ventricular premature complexes in our pets. We've seen these extra heartbeats are definitely not simple. They can range from, just an incidental finding on an
Mhm.
exam, all the way to being a critical warning sign of serious disease elsewhere in the body, or a direct risk factor for collapse or sudden death. And I think the biggest insight for me is just how vital it is to find and treat that root cause.
Absolutely. Which often isn't even in the heart
It's
itself.
exactly.
It really highlights how sophisticated veterinary diagnostics have become, doesn't it?
Hmm.
Putting together clues from the physical exam, that crucial Holter data,
Yeah.
imaging like echo and ultrasound, detailed blood work, all to build a picture of why these beats are happening.
And the management reflects that too. It's often not just about giving a heart rhythm drug, but it's a whole body strategy dealing with the gut, the spleen, hormones, electrolytes, pain. It really underscores how incredibly interconnected everything is.
It does, profoundly. Which kind of leads us to a final thought for you, our listeners, to consider. Given how many issues seemingly unrelated to the heart, like a bad bout of pancreatitis or just low potassium from vomiting, can trigger these potentially lethal heart arrhythmias, what does that truly tell us about the intricate, almost delicate balance within an animal's body?
Yeah. It raises a really important question, doesn't it, about how crucial it is for vets to always look beyond the presenting symptom, to consider the whole animal, taking that truly holistic view to find the real driver behind the problem. It's a huge challenge, but also a really powerful insight into animal health, I think.
A fascinating point to ponder, definitely.